All right, 8:16 right now, Brian, thanks. Our state sending out this reminder, October, Breast Cancer Awareness Month. And this morning, we're looking closer into programs in our state that we offer to help prevent the disease. So joining us live this morning with the State Secretary of Health, Dr. Umair Shah. Dr. Shah, good morning.
Good morning. How are you?
I'm good. I'm good. Thanks for being with us. You know, October is wrapping up, but, it's still the perfect time to talk about breast cancer awareness. Start out by telling us some of the programs that are available through the state to help people prevent breast cancer.
Yeah, first of all, this continues to be those conditions that we are absolutely wanting to make sure that, especially women, but also men, are thinking about both the awareness, the importance of screening, the importance of getting tested, and the regular check-ins with their healthcare provider. Hopefully, they're doing those things, but we have programs in case cost becomes an issue. And our breast cancer cervical program and colon health program is really a program that has helped tens of thousands of people over the 30 plus years that we've been in existence. And really what it's about is trying to help alleviate those costs that oftentimes go into screening and then obviously the diagnostics standpoint as well.
Right. Can we talk a little bit about why early detection is so important when it comes to, especially breast cancer in particular?
Yeah, well, as you know, in medicine, as a physician, I'll tell you, this has been one of those challenging points that we try to remind everybody that as early as you can detect something, the more likely you are to be able to catch it in an early stage. And the vast majority of being able to detect breast cancer is really 65% that are really in those early stages where you can actually do something therapeutic, something treatment wise that is going to really not be that invasive. And so that's good news. But that means you got to catch it early. And we've got gaps, gaps in our state and our communities about who is getting screened and what the awareness that in certain communities are. And so what you start to see is this widening of people who are not getting screened. And then you have other people in our state who are getting screened. We've got this situation where breast cancer continues to impact women throughout our country. And now we're also learning over time that men also have to be thinking about what their risks are. And so early detection is the key. And so this is why we continue to remind everybody, please get detected by getting diagnosed, by working together, by doing all sorts of things. They're going to allow you to get, the screening that is going to do what needs to be done.
On that note, when we talk about getting the screening that you need, we just did a story yesterday that was like, I think it said something about how not all mammograms can detect breast cancer if you have dense breast tissue. What is in place to hopefully help people in that situation get the proper screening so they can get the correct diagnosis?
Yeah, sure. No, that's really important. So, what we remind everybody is that, obviously, every test, whether it's a mammogram or it's an additional, like an MRI, these are tests that are obviously designed to detect breast cancer. You got to remember that it's really also about the breast tissue. If the breast tissue is dense, it's thicker, it's more difficult for some of these screening tests to pick those up. So that's why we've got to really do a few things. One is we've got to know our risk, which includes what's our family risk, what's our predisposition for breast cancer. We also have to be thinking very carefully about how we lower that risk. And that is the screening that we've been talking about, which means monthly self-breast exams. We want to make sure that, our women are doing these self-breast exams, because ultimately when you see a change or something that's different in breast tissue, that's when you want to be certainly doing everything you can to get it checked out. And then finally, it's really about getting in to get it checked out and to have that regular check-in. But the mammogram and all these other, tools that we have, they're great tools, but there are certain limitations, especially as you said, when it comes to more dense breast tissue. Now, it doesn't mean that there aren't other tools. It just means that you've got to work very carefully with your healthcare provider.
All right, State Secretary of Health, Dr. Umair Shah, thank you so much for being with us this morning. Great information, important as well. We've got a link posted to our state's cancer screening resource page as well, if you would like to find it on fox13seattle.com. Thank you.